Welcome back to Studio 10, everybody. Do you or someone you know have what looks to be blue feet, where all the little veins are appearing on the surface of the skin, resembling an area of bruised skin? Well, it could be a harbinger of a larger problem, and the good news is it's treatable. I'm joined today by our favorite vein doctor, Dr. Daniel Mountcastle from Mountcastle Vein Centers, and we're going to talk a little bit about this problem today. Now, I've heard about people having cold feet, but I've never heard of blue feet. What exactly is this condition about?
Blue veins, veins that are dilated down around the ankles and on the feet. It's a common sign, early sign, of failure of the valves in the larger veins above. The veins are like an upside down tree. There are 5 systems that drain each leg. There's a trunk, branches that become varicose veins inside the leg usually, or sometimes on the surface, and twigs. And when the valves above have failed, those twigs, those capillaries down around the ankles are holding up a column of blood up to your heart instead of the next inch or two to the next valve. So they dilate and they become blue, and it's called phlebectasia, a physical sign of vein failure. So
what exactly is the problem then at that point? Do you risk your feet going numb? Do you risk what exactly is the problem therein?
Well, you're at risk of developing, or it's a sign that you have, failure in those valves above, and that gives you varicose veins inside your leg, which make your legs feel tireder and heavier and older than they should. Varicose veins dilate on the surface, and the capillaries, those blue veins, are just 1 out of 10. There's 10 more inside that are leaking fluid and blood and protein and give sick skin and scaling and ulcers and night cramps. And so people should know it's an easy thing to see and
to take care of. And it looks like we're taking some pictures, or we're looking at some pictures right now, and you mentioned to me before the segment that these are actually all very recent, which means that this is a pretty common problem.
It's very recent. I took these pictures in the last 2 days in our office, knowing that I was going to do this segment here, trying to give people an idea of what they look like. And I think a lot of the viewers will look at these and say, oh my gosh, I have this. I have these blue veins along my instep and on my ankle and on the outside of my feet. And they should call and get an ultrasound. We can see if there's a problem up above and stop the damage that venous hypertension causes. Nip it in the bud in a way. And their legs will feel younger and they'll look younger.
And we've definitely met some of your patients before who look, I would love to have legs like theirs. So you can really correct the problem. What exactly is your process like versus the old process of, I know it was, I believe it's called vein stripping, which was, I think, very painful.
Everything's changed. All the procedures are elegant. In medicine, to be elegant, a procedure has to not hurt, always work, not lay you up. And these procedures don't hurt. Everything's changed. No more vein stripping. We do a 20-minute laser procedure. No more scalpels to cut out varicose veins. You just use a tiny pinhole, and through that work, and so it leaves no scars and gets rid of all the varicose veins. And no more saline injections, just sotrodecanol, which always works and doesn't hurt.
And your patients walk right out of the office.
Right. In fact, we ask them to walk 15 minutes around the shopping center or the office area before they go home, take a nap, and then go back to work.
And this is, I think people need to realize too that there's not really, there's been a stigma attached to things like varicose veins before. People are ashamed. There's no reason to be ashamed. It's not necessarily denoting a poor lifestyle or anything like that. This just happens.
We're like fine old homes. We're great for about the first 30 years, and then we start to fall apart a little bit. A shingle falls off and a door won't open. We just kind of keep up with the repairs. These are mostly genetic issues. Most valves fail because of just genetics. And more young people are recognizing this early on and fixing it. I saw a 42-year-old lady and a 60-year-old lady. They were obviously mother and daughter. She had these blue veins at her feet, and I said, you know, you have phlebectasia and your legs are going to look just like your mom. She was standing there in pants. How did you know? She said. I said, well,
you can't even see my legs right now.
You're clearly her mother. This is very genetic. Oh, my legs were just like my daughter's when I was her age. And now I couldn't possibly show them. I said, well, I know you're standing here in pants and it's 80 degrees in Florida. You ought to get your legs fixed, and we ought to stop your daughter's problem before it gets like yours.
And we want to take a look at the pictures one more time, because I want to make sure that our viewers at home get an idea of exactly what we're talking about when we're talking about blue feet. Now, there are other signs, obviously, of damage inside in your veins, inside your legs, and varicose veins in and of themselves are really just a signal of perhaps something else going on inside.
They are. They're just the dilated branches of one of these upside-down trees, and it's just a sign of venous hypertension. And if you take the pressure off, they begin to shrink. Inside, the swelling and the pain goes away. The leakage from the capillaries down at the bottom of this upside-down tree stops, and your leg is healthier, and you have less chance of deep vein clots, which are a very serious issue.
Now, Dr. Mountcastle, I know that right now there are viewers at home wanting to know how to get a hold of you, and I know that you are always willing to talk people through the whole process of getting checked out. And I mean, you even told me it's a great idea at my age to go ahead and get checked out just to see, to find out.
We offer a free educational consult and sit down and talk about your concerns and tell you about veins, and then we schedule the patient usually for an ultrasound, which is very clear-cut. I mean, there's no guesswork about it, and we know if you have a vein problem or not and how to fix it.
And there are the two convenient locations for you, one at Isla del Sol and one at Bryan Dairy Road in Largo, and you can call 727-865-6941. You can also go to mountcastlevaincenter.com to learn more, and of course, as always, we will hook you up at studio10.tv as well.